Pets Life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.
And a very good morning to you all, and a very good morning to Des Groom. Des, how are you?
Yeah, hi John, great to be here, thanks.
Right, it's been, the cold is getting in.
Cold is getting in, and the dogs and cats feel the cold as well as we do.
Of course they do. They'll come into the house and they won't want to leave now at this stage, or whatever the case may be. But of course, arthritis is one of those things that would have effect in the cold weather too, would it?
Yeah, it's a big subject in the veterinary world nowadays, arthritis, in dogs and cats. And they do feel the cold. Older animals at this time of year should be in somewhere nice and warm and well insulated and dry, especially at night.
Yeah. Most people, though, a lot of people still keep their dogs outside in kennels permanently, regardless of the weather.
Not so much anymore. There are older dogs that still love to live out and prefer to be out.
Yeah.
But and look, they need fresh air. Oftentimes pets, dogs and cats, they don't appreciate the level of insulation in modern houses. Our houses can be a bit stuffy, the air can be a bit dry. Sometimes they're healthier outside, but if they are outside, they need to have a well insulated dry kennel or shed to go into at night.
Yeah, and that's it. Cozy up, especially with those inclement weather comes in. You were talking about that it's a big subject. Why?
It's possibly becoming more common, more of an issue as our dogs live longer. There are two aspects to it. The type of selective breeding that have taken place over the last number of generations in pedigree dogs has led to more forms of juvenile and inherited arthritis. That's the first thing. So that's the first whole category of arthritis I'd like to touch on, juvenile arthritis. And then the other big aspect of arthritis that's a factor as our pets live longer is the wear and tear, the old degenerative arthritis of older age.
Okay. Now, in a good way, it's kind of a catch-22, because what you're saying is that the animals are living longer.
They are.
So that means they're being fed right, they're being walked right, they're being looked after, maybe a better all-round state of living.
Yeah.
But that leads to the other problems like arthritis further down the road.
Wear and tear. So the term would be DJD, degenerative joint disease. That's wear and tear from dogs having a busy old active lives and getting to 10 or 11 and they're stiffening up. So what do we do with the older dogs that are coming in? Bit of management, bit of treatment, and we have a look at how we can improve their lives. And improving their lives means giving them a better quality of mobility so they're more active for longer, and also that they do live longer with the extra bit of help. The very first thing to think about is, just like with people, fitness and weight. We want them to get onto a good senior diet with adequate calcium and glucosamine and chondroitin and all the good minerals in it, and to be fed the right amount of it, not too heavy, good muscle tone, good joint support. Diet is massively important. Second thing then is exercise. Older dogs, like younger dogs, it should be exercised little and often. They don't need the big long walks where they're going to be sore afterwards. They need more shorter walks, more stimulation, more general exercise. So little and often is the key. Exercise, that's the second category. And then the third category then, if there already is arthritis there, wear and tear. Again, it's not about giving them a pill and letting them rest up. No, it's about, yes, give them some treatment and get them moving. Because with movement, the arthritis can be prevented from getting worse.
That's a bit like humans too as well, really, isn't it?
It is.
The more you do, the better it is, providing you take it in proportion to the arthritis in itself. Okay, so let's look at the older dog first of all. Does it affect males more than females, females more than males?
No, it's a kind of a breed predilection there. Your bigger dogs might be worse, might get worse younger.
Okay.
Bigger, heavier types.
So the big ones, like
larger breeds, Labradors.
Are you talking about Labradors and Collies?
Labradors, Boxers, German Shepherds, a big one. Then your large breed dogs, Great Danes, St Bernards, they'd suffer a lot with it. Yeah, they would. Treatment options, really, first of all, for quality of life, we want them to have some pain relief. So there are various different tablets in terms of a daily tablet, an anti-inflammatory that will help them feel a bit better, help them get out of bed in the mornings, help them keep moving. And moving beyond that, because we all know that tablets can be hard to give and tablets can be hard on the stomach sometimes and so on, there are great new injectable treatments available to us now. A breakthrough drug that's come out in the last couple of years called Librela, which is a monoclonal antibody. It's a whole new category of treatment and pain relieving drug, the monoclonal antibody, also in use in human medicine. And the monoclonal antibodies help these dogs with arthritis, and generally it's a monthly, 1 to 2 monthly injection. So 6 or 8 injections a year, and they're keeping these dogs moving, keeping them going.
Okay, arthritis in a general term for when the joints have abnormalities and the cartilage between the joints progressively wears away.
Very good.
Cartilage is a cushion that protects the joint during the movement. So in animals, what are joints are we talking about?
So hips is a big one, big area. Yeah. Right, and a lot of that can come from congenital or inherited problems. The bigger dogs have less than perfect hips. There might be a type of hip dysplasia there in a lot of these bigger breeds. Hip dysplasia is unfortunately too common, and what hip dysplasia does is it sets the baseline, it lays down the foundations for arthritis later. So cartilage damage means that you get a grit in the joint, and that affects the lubrication and affects the movement and causes pain.
Okay. Different types of arthritis, does it affect different ages or breeds of dogs? Yeah,
juvenile arthritis then, younger dogs, right, again German Shepherds and some larger breeds, and actually even it's you'd be surprised the ones that can get it, Cocker Spaniels, elbow arthritis. There's something an older vet said to me one time, if a dog is lame in front, 80% of the time it'll be the elbow. And that's true, believe it or not. If you've a dog and he's limping and sore in front, there's a very good chance it'll be his elbow. The elbow is a complicated joint, and with lots of little bones tightly knitted together. And the elbows in dogs carry a lot of weight, they take a lot of strain, so they get arthritis in their elbows earlier in life than they would in any other joint.
Okay, Ciara's on, she says her Labrador was in an accident when he was 5. He came through it, he's now 7.5, 8. The vet did say that he might get early onset arthritis as a result of the trauma.
Yeah, any broken bone injury, road traffic accident, unfortunately, they're the older dogs with the wear and tear injuries. That get arthritis. So the whole thing is, keep him fit and light.
Okay.
Not to carry too much weight. I'm often able to show people over the course of a few months that if a dog loses the 5 kilos extra, they're even able to come off the arthritis medication.
That's brilliant, isn't it? That's absolutely class. What are we talking about symptom-wise for these dogs and cats?
Slow getting up in the morning, literally. Slow getting up out of their basket to get moving.
Okay.
Getting tired on walks and slowing down. Reluctance to go as far on their walks. Maybe wanting to turn for home. That can be a symptom. Another symptom can be just that they come back after the long walk and they're wrecked and they'll lie in their basket for 12 to 18 hours after it.
Okay, and somebody else just messaged in to me that she's noticed that her dog was licking and biting an affected area for a long period of time. We brought to the vet a couple of times. She said eventually it was diagnosed with early onset as well, arthritis, and the initial symptom was licking and biting the affected area. That's because he probably just discomfort, was it?
Yeah, discomfort. Now, if it's a gradual low grade, kind of a slow onset type of a stiffness, they won't lick and bite like that. That what that lady describes is a sudden onset, acute pain. So he began to noticeably move towards that area because there was an acute recent pain. So that would suggest a sprain or a recent injury or some other type of acute inflammation in the joint. That won't be noticeable in the case of the old bit of wear and tear that's just creeping up gradually.
Okay, interesting question coming in from Melissa, who says that when she brought her dog to France on holidays, the dog was in pain. The actual vet suggested acupuncture.
Yeah, there are vets that do acupuncture. It's a specialist field. It's a little hobby topic for a good few veterinary practitioners. And
is it a case because they see that it works in humans that they might work in animals?
Yeah, that was the initial premise. And then vets started to do it, and they began to map the acupuncture points in dogs and cats and horses. And it's evidence-based. Seeing is believing, in the sense that vets found and owners found that it seemed to work. But you need to keep doing it.
Yeah. What about living with arthritis now within dogs? Caring for your arthritic dog or cat.
Yeah, so caring for your arthritic dog and cat, just to touch on the juvenile forms of arthritis. Okay. So caring for a young dog that's suddenly appears to be a bit slow and a bit lame. A young dog shouldn't be lame. Shouldn't. So it's a worry if you have a young dog holding up a front leg or holding up a back leg.
And it's not a trauma.
And it's not just a bang,
injury,
right? Little bang. Then that's a worry. What's happening there is sometimes you get these juvenile forms where the bones are a bit soft, the cartilage is a bit soft. They might grow too quickly, and then the cartilage and the synovial fluid comes under pressure, and you get joint damage, and you get this type of juvenile arthritis. Now, caring for these at that kind of risk age between 6 months and 18 months, when there's still growth and development going on, is tricky, because you have to limit it's management more than treatment. You have to limit their exercise to little and often. You have to get them on the right food with the proper blend of calcium and minerals. And you have to make sure that they're not carrying too much weight. So these younger dogs with a bit of arthritis, you need to keep them fit and slim.
Yeah, and that's the key to the whole thing, isn't it?
It is.
We've been talking about this since you started coming on board with us, about kind of keeping your animal healthy as you are.
Yeah.
If you're thinking healthy for yourself, make sure you're doing the same with your animal.
Yeah, because one of our missions at Gym Dog is to strengthen the human-animal bond and to bridge that gap, that gulf in understanding between pet owners and their dogs, to help them understand that, yeah, dogs are different. They have different instincts, they have different natures, they don't think like us, but on a lifestyle level, if you have a really good lifestyle yourself, then your dog should share that lifestyle, and both of you will have a better quality of life.
Yeah, okay, Geraldine was on. Separate question. She says, I have an 18-year-old cat who's generally in good health. She's from Laois, she says, but unfortunately yesterday I got up and I found that our cat was very, very wobbly out of nowhere. All of a sudden, wobbly, losing, I suppose. Yeah,
the first thing that springs to mind there is that I think of vestibular disease. Again, it'd be really typical, common in older cats.
Yeah.
It's a type of an inflammation or an infection in the ears that can affect the balance.
Okay.
So that's something to look at.
Okay, so get him down to a vet, take a look at him,
yes.
And they'll take it from there.
18 is really old, obviously. For
obviously, so yeah, there could be just kind of life expectancy coming towards a different direction, but we'll have to wait and see. But Gerald, don't want to dishearten you too much. First things first, bring him down to your local vet and get it sorted, and you'll get the advice that you need from your veterinarian. Now, the other one was, I just saw something coming in there. Where was? Oh yeah, here's one. This was a question: is do orthopedic beds for pets work?
They'll help a little, in the sense that an orthopedic bed might be very helpful for dogs with hip dysplasia, arthritis in the heavy joints, or arthritis in the spine or in the back. Okay. They do get bad backs on a general level, just like people do.
Yeah.
So disc disease is another type of arthritis that older dogs can get. That's where the wear and tear occurs between the spinal bones.
Yeah.
And the little spongy discs between the spinal bones get calcified and gritty. Yeah. And you can have stiffness and pain in the back, in the lower back, which affects their ability to get up out of bed. And the orthopedic bed, the orthopedic bed will be grand, but again, remember, a lot of the trouble with these dogs occurs when getting up out of their bed onto the floors. Most of us nowadays live in houses with wooden floors, right?
Yeah.
Wooden floors and tiled floors.
Yeah.
Oftentimes these older dogs, they don't like the slippy floors in the modern kitchens, and an older dog will arrive at a point where he doesn't have confidence getting up out of his bed and stepping onto the kitchen floor anymore, and will appear to collapse and just not be able to manage. So one of the things I always tell owners of older dogs that live indoors is have a nice big old carpeted area of say 3 to 4 meters square, and put the dog's bed on a bit of carpet in a quarter corner of your kitchen or your breakfast room. And when he gets up out of his bed, out of his basket in the morning, and he stands up to have a stretch, you want his front legs and his hind legs to step onto a non-slip surface. Yeah, okay, brilliant stuff indeed. Good comment coming in now. This is from Jessie Ryan. She says, we have a cross between a Labrador and an Alsatian dog, diagnosed about 2 years ago back with beginning of arthritis. We were advised, like what Des says, to bring him for short walks, so that's what we do. We get up early in the morning, bring him for a short walk, and subsequently in the evening times. The short walks have given him a whole new lease of life. Yeah, that's great. That's good feedback, proving that the little and often rule works in practice.
Okay, well done on that. Damien was on. His dog is limping on one side, predominantly on the back left. He's been at it about a week or two. He doesn't seem to be in too much stress, just basically lifting the leg up.
Well, you see, again, it could be anything. We always start down at the toes and we have a look. Is it a broken nail? Is it a stone bruise? Is it a little cut or an ulcer or a scratch on the pad? Yeah. And then you work your way up from there and check the joints.
Yeah, okay. I suppose after a couple of weeks, if it hasn't healed, wrap it down to the old breath and they'll do a little bit of a check. When it comes to animals with arthritis or generally stuff like maybe going into the elder cats and dogs, how often should we be bringing these guys to the vets for checkups?
Yeah, but probably more often with an older dog, as compared to a younger dog. So we see puppies very regularly in the first 18 months of their lives, and that's what we want. We want to be seeing puppies every few months and checking their growth and checking their weight. And then from about 18 months to 6 or 7 or 8 or 9, oftentimes we might only see a dog once a year for his annual shots, which is fair enough. But after about 9-10 years of age, I always say to owners that after 10 years of age, 3 to 6 months is a long time in a dog's life when he's 10.
Yeah.
So we want to be seeing them every 6 months and checking their weight and their mobility and having a chat about their quality of life.
Okay, and another one in following from the arthritis. While you've been talking about dogs, what about cats with arthritis? What are the symptoms? Because we all know cats hide their pain.
Yeah, cats hide their pain. They're solitary. They're more sedentary as they get older than dogs, but it's a really good one. Cats will lick more than dogs when they're in pain. So areas of discomfort, they will get patches of hair loss from licking over joints that are painful. They will become noticeably much less active, right? And something that's common in cats is a general change in their temperament. They become less social, less amenable to handling if they're stiff and sore.
Okay, and another one, just can you recap on medication for pain within dogs for arthritis?
Yeah, the newer pain meds, Librela, once a month injection. It's a type of an antibody. The one for cats, which is the same, it's the monoclonal antibody, is called Solensia. So that's the new treatment, which is replacing the daily pill, is the Librela injection for the dog, the Solensia injection for the cat. Really effective, really safe new drugs, a monthly injection. The owner has to do nothing other than bring the dog to the vet once a month, have the little check-up, check the weight, give the shot.
Okay, so let's recap on this. So first of all, when you've brought your animal to the vet,
yeah,
you've given it the diagnosis. The diagnosis is arthritis of some form or another. We're saying that realistically, age profile, what are we talking about, cats? Age profile?
After profile. 10.
After 10. So you're talking about 10 o'clock,
yes.
10 years old onwards. So from the diagnosis to getting the injection once a month, we know about the healthy issue, eating healthily, and bringing them for short walks. Anything else?
Look, if you have no budget, oftentimes we'll make a diagnosis on clinical signs and on quality of life issues, and we'll have a chat on a general level. But it's always best to do the x-rays first and confirm exactly what's going on, because worst case scenarios sometimes, especially with acute, very recent onset sudden pain in a joint, unfortunately cancer is there in the background as the big worry. Yeah. Bone cancer is common. A breed that sticks out now straight away pops into my mind, Rottweilers get bone cancer, and it's very sudden and it's very serious
and very quick. Yeah.
So x-rays if the budget is there for it, right? Then treatment wise, we've moved away from the older idea in medicine and in veterinary of just it's either a surgery or a pill. Okay, now it's all about diet and management and fitness and lifestyle and the monthly injections. Aside from the monthly injection for the dog, Librela, the monthly injection for the cat, Solensia, there's another one called Osteopen. John, you recapped there about the anatomy of what happens in a joint with arthritis, about the damage to the cartilage and the damage to the fluid. Well, there's a really good drug called Osteopen that improves cartilage health and improves joint fluid health.
Yeah.
So it's a different type of a painkiller, works in a different way right in the joint. Osteopen. Now what that is, it's an injection a week for 5 weeks, once a year.
Okay.
And that's a joint supportive drug. So that's the second type of injection we use. Then following on from that, further down along the line. The older treatments include Metacam, Rumacam, liquids, kind of a Calpol type that helps with the daily bit of stiffness. And then you have your anti-inflammatory tablets, which there's a whole range of them on the veterinary side, and they're more or less similar to Nurofen, ibuprofen and so
Excellent.
on that people are familiar with.
Okay, one final question. Hi there guys, great listening, really enjoying it. My dog had something that looked like a spasm on his back and leg when he was limping or when he was lame. It could be limping or lame, it's spelled IMB. Any ideas what could cause that? Muscle.
Yeah, that's a soft
tissue
injury.
You often see that with cats or animals or dogs, and they get up and they do a little bit of a shake, and you think they're having a seizure, but they're not. It's just
they're stretching.
They're stretching
the muscles and all the rest of it. But soft tissue injuries would manifest themselves as swelling or spasm of a muscle. Yeah.
And the other thing is, if it's once as one off and you don't see it again, it's okay. But if it's the case that you see it and it looks a little bit kind of dodgy, then get it down to it.
I always say to people, ring up and say, oh, he's lame today after his daycare. What do we do? Wait a day or two.
Yeah.
There's no point in us looking at a dog today who's just lame today.
Yeah, okay, absolutely great stuff indeed on that. Des, a great way to wrap up today, and it's Pet's Life. And if you want to get in touch with the man himself or any of his crew,
give us a buzz at Kildare Vet Surgery or try online at petslife.ie.
That's it, we'll do it all again.